Hi, I'm Kurt Schwiesow, glaucoma specialist at Tower Clock Eye Center. Just want to talk a little bit today about new implantable drug delivery devices for glaucoma. Um, Glaucoma is a very common disease. It's a very treatable disease. It's where eye pressure inside the eye is too high, and over time that can damage the optic nerve, which eventually can cause irreversible loss of vision. So the way that we treat glaucoma is to bring your eye pressure down. And this has been done historically using a combination of medications in the form of eye drops. There are laser treatments, there are surgeries to reduce the eye pressure, but for the majority of patients, we're talking about putting in daily eye drops once, twice, or even 3 times a day. And sometimes that can be kind of cumbersome. There are some patients that require up to 9 drops a day. So we're always looking at ways to try to minimize eye drops for patients, try to make their treatment more tolerable. And there are some newer, exciting products on the market that give us another tool in our toolkit to do that. These are implantable drug delivery systems. So in other words, it's a medication, but rather than putting it in eye drop form every day, it's actually implanted inside your eye and slowly releases medication. So there are 2 main products out there. One is called Durysta. This is a medication called bimatoprost. It was released about 6 years ago. It was FDA approved. Neat idea. It's just a nugget of medication. So it's on like a polymer. It's a tiny little, basically a tiny little nugget of medication that's injected into the front of the eye. And it floats around and slowly releases bimatoprost, which is effective at bringing eye pressure down. A couple of drawbacks with Durysta though. Number one, it's not repeatable. Because that nugget floats around in the front of your eye, it does very slightly cause a little bit of damage to the cornea. That's the clear part of the front of the eye. It's insignificant damage, but if it were repeated again and again, it might cause the cornea to become clouded, which gives you a whole different issue that we don't want to deal with. The other issue with Durysta is that it's really only effective for about 4 to 6 months for most patients. There are some patients, about 28% of patients, where the efficacy is up to 2 years, but it's a minority of patients. So realistically, you can expect about 4 to 6 months. So I don't use Durysta because it doesn't have a role in my practice. I don't have any patients who only need their eye pressure down to 4 to 6 months. Where having this device implanted is going to make a difference for them. So I typically don't use it in lieu of eye drops. But there is a newer device that came out about 2 years ago called iDoseTR that I do use. And it's interesting. It's a couple of different things. Number one, it's a device. Durysta was created by a drug manufacturer. iDoseTR was created by a device manufacturer. So it is actually a titanium device that goes into the front of the eye. It's anchored in the front of the eye. It doesn't float around. It doesn't come into contact with structures it's not supposed to. So it doesn't cause that collateral damage, number one. Number two, it's effective for 3 years. So it's a really good duration of effect. And number three, it is repeatable. So when that device runs out of medication 3 years down the road, we can go in, we can remove it, and we can implant another one. So for patients dealing with a lifelong disease like glaucoma, it makes a lot more sense. It does require going to the operating room. We need a microscope in order to visualize the eye properly in order to implant this thing. But the process is still only a minute or 2 to put it in. Recovery is very short. And then it keeps people largely out of at least some of their drops, which is a benefit for sure. So exciting stuff. I'm expecting more on this front over the next 6 to 12 to 24 months. But I think this is a really exciting direction for glaucoma treatment for my patients.